Hi everyone, my name is Natasha Rodriguez, and today I'm going to be talking about HIV and AIDS, also known as human immunodeficiency virus infection and acquired immunodeficiency syndrome. Typical patient presentation. A 35-year-old male presents with symptoms of fever, night sweats, chills, and a rash. A few weeks later, he returns to the clinic with worsening symptoms including 30 pounds lost within 3 weeks, sores all over his body, and prolonged swelling of his lymph node glands. He claims he had unprotected sex with another male before the initial flu-like symptoms began. Etiology: HIV is caused by a retrovirus that enters CD4 T lymphocytes and leads to cell death, increased risk of infections, and can lead to AIDS. The virus that leads to HIV can be spread only through sexual contact, blood transfusions, and from mother to child through pregnancy, birth, or breastfeeding. So you may be wondering, what is the difference between HIV and AIDS? HIV is a virus that damages white blood cells, which decreases your immunity. HIV can lead to AIDS, which is diagnosed once the CD4 T lymphocyte count falls under 200. HIV interferes with your body's ability to fight off infections and diseases, hence the decreasing immunity once you contract it. AIDS is an immune deficiency that develops after being infected with HIV. AIDS can be chronic and can be life-threatening, oftentimes being fatal. So it takes several stages for HIV to turn into AIDS. These include 5 different stages, starting off with seroconversion illness, asymptomatic infection, persistent generalized lymphadenopathy, symptomatic infection, and then AIDS. And I'm about to cover all of those right now. So seroconversion illness occurs 1 to 6 weeks after acquiring the HIV infection, and the feeling is usually similar to flu-like symptoms. Asymptomatic infection occurs after the seroconversion illness. This is when virus levels are low and when the HIV replication continues slower. CD4 and CD8 lymphocyte levels are also normal during this stage, and this stage usually presents with no symptoms and can persist for years. The persistent generalized lymphadenopathy is when the lymph nodes in people who have HIV are swollen for 3 months or longer. Symptomatic infection is a stage that manifests with symptoms. This is where there may be more opportunistic infections. There is usually a collection of signs and symptoms that are referred to as AIDS-related complex, and it's regarded as a prodrome or precursor to AIDS, which means it usually occurs right before a person contracts AIDS, or before their HIV turns into AIDS. And then AIDS is the final stage, which is the most life-threatening. This is where there's severe immunodeficiency and there are signs of life-threatening infections and even unusual tumors. And this stage is characterized by a CD4 T cell count below 200. There's also a small group of people who can develop AIDS very slowly, or they may never develop it at all. And these people are usually referred to as non-progressors. Background: 80% of HIV infections throughout the world are through heterosexual transmission. It is more common in ages 25 through 44. It is 5 times more likely to affect men than women. Men who have sex with men are 19 times more likely to have HIV compared to the general population. Between 1981 and 2015, about 41 million people have died from HIV. About 3 million deaths per year are due to AIDS, and about 1.2 million people in the US have had HIV at the end of 2019. So risk factors include sexual activity with no protection, as HIV can be transmitted through vaginal or anal sex as you come in contact with bodily fluids, injection drug use, especially if you're sharing needles, children of HIV-infected women through pregnancy, birth, or breastfeeding, and this is very rare, but occupational exposure, when broken skin comes in contact with a patient's blood whom was infected with HIV. Pathophysiology. HIV is caused by a retrovirus that converts RNA into DNA, which infects and changes a cell's genetic material. Once the cell is changed, it leads to lysis and death of the cell and spread of the HIV virus throughout the body. The primary surface receptor of HIV binds to CD4 lymphocyte surfaces. The CD4 lymphocytes are important for developing plasma cells and cytotoxin T cells. HIV binding to CD4 T cells leads to suppression of the immune system, causing deficiency and can later lead on to AIDS. So right underneath the fusion inhibitor, I am circling where reverse transcription of the viral HIV virus turns from RNA into DNA. So as mentioned in the previous slide, during this process, the retrovirus converts RNA into DNA, which infects and changes the CD4 cell's genetic material. So then, after that, all the way at the bottom, we can see where reverse transcription occurs and then turns to integration of the cell's nucleus. And then over here, we could see a release of viral proteins from the HIV virus. And once the translation of the viral DNA is complete, the mature virus releases into the body, and it begins to move throughout the body until there are normal lymphocytes to help immunity. So this is another image that shows a little bit more in depth of how the HIV viron changes the CD4 genetic makeup and turns it into a mature HIV viron. When HIV decreases immunity, it can lead to opportunistic infections and even some cancers. These opportunistic infections are caused by certain organisms that do not usually infect healthy people. So, when there is a decrease in the CD4 helper T cells, this causes a diminished ratio of those CD4 and CD8 T cell ratios, as well as causing irregular B cell antibody production. Once the HIV virus begins to fuse to the lymphocytes and damage them, there's also a decrease in immune responses from some antigens, leading to host cells not being able to respond to these opportunistic infections properly. And while all this affects cell immunity, the infections are usually fungal and viral rather than bacterial. So this is a little table that shows the phases of the HIV infection, so I'm going to go through and read a little bit of each of them. So the first phase is the acute phase, which I mentioned before is also the seroconversion illness stage. This is weeks after initial infection, where the virus quickly begins spreading and attacking CD4 cells, and during this time there is an increased risk of transmission to other people, and there are also antibodies being produced during this time against the HIV virus, which cause the initial flu-like symptoms. Then we have the chronic latent phase, which is also known as the asymptomatic infection stage. This is where the antibodies that were produced in the acute phase slow the virus's replication, but they do not stop it. There are medications that can allow a person to stay in this phase because it reduces the damage the virus causes on the CD4 cells. And then finally, we have the advanced HIV infection phase, which we know as the AIDS stage. This we know is the most dangerous, which can be fatal, and without treatment, this chronic infection can progress more and more and can lead to death. The average time where a person can advance through this phase is 8 to 10 years before it can be fatal. This is when the immune system is severely damaged and it can no longer fight off infections. This is also where, again, the CD4 count is less than 200. Symptoms. Flu-like symptoms can last 2 to 4 weeks after initial infection. These include swollen lymph nodes, fever, night sweats, mouth ulcers, fatigue, chills, muscle aches, and rash. And then if you have AIDS, that can sometimes be fatal, usually can be fatal. So you can't really rely on symptoms to tell if you have HIV, so the only way is to get tested. Diagnosis. There are antigen and antibody tests that a person can take. The HIV antigens will be detectable on a positive test from drawing blood through a vein, and antibodies can take weeks to even months to show exposure to HIV. And as we know, symptoms can even take 2 to 4 weeks to show up, so it'll take a while before a person will even notice if they have HIV. Then there are nucleic acid tests, which this looks for the virus in your blood by drawing blood from a vein. And then there are tests available to determine the stage of the disease, such as CD4 T cell counts, viral loads of the HIV RNA, and drug resistance. And these tests are usually taken if you think you've been exposed. Treatment. So today, currently, there are no cures for HIV or AIDS, but there are ways to control or prevent it. Starting off with antiretroviral therapy, which is mainly for those with HIV to prevent transmission to others. It involves a combination of 3 or more types of medications, which I'm going to read now. These include non-nucleoside reverse transcriptase inhibitors, nucleoside or nucleotide reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, entry or fusion inhibitors. A few other ways to prevent HIV include male circumcision, antiretrovirals, which prevent mother-to-child transmission, and you can make sure to always practice safe sex and use condoms to prevent spread of STIs and STDs, and to prevent yourself from getting infected with HIV. And finally, this is a little chart that shows the course of the HIV infection if it is untreated. So beginning with the infection, 2 to 8 weeks, we see that the viral load of the HIV virus grows over time, and then the CD4 count begins to drop 1 to 3 months into the infection in the seroconversion stage, and it begins to drop, and so does the viral load halfway through because of the antibodies that begin fighting towards the infection, which again don't stop it, but they slow down the replication of it, so that's why we see a drop. And then there's this asymptomatic stage, which is no symptoms or anything. And then we see that over time, with no treatment, the viral load begins to grow again and again, really high to 2 million copies. And then that's usually when a person contracts AIDS and can lead to death because the CD count drops through the years. And then these are my references. So, thank you.